everyone. Good morning, everybody. I'm Priyanjali from Prostate Wellness Team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, which is renal calculi. Renal calculi or kidney stones are hard pebble like pieces of material that form in one or both your kidneys when high levels of certain minerals are in your urine. Kidney stones vary in size and shape. They may be as small as a grain of sand or as large as a pea. Rarely, some kidney stones are as big as golf balls. If you have symptoms of kidney stone, including severe pain or bleeding, seek care right away. A doctor, such as a urologist, can treat any pain and prevent further problems, such as urinary tract infection or what we commonly call as UTI. To throw more light on the subject and guide us on what's right for diagnosis and treatment of renal calculi. Today, we have with us renowned urologist Dr. Vikram Deshmukh, MBBS, MS, DNB urologist. He has a rich experience and hands on expertise in stone management as well as in treating urological problems. He's currently practicing as director in Shri Urology Hospital, Amravati. Dr. Vikram Deshmukh has rich experience in the field of urology and carries out the renal calculi diagnosis and treatments with utmost precision and efficiency, ensuring that the patient health is in safe hands. Over to you, doctor. A warm welcome to you. The first question for you would be, what are these kidney stones?
Yes. So good morning, everybody. Uh, Kidney stones are basically stones that form in the kidney or in the urinary system. They can migrate to the ureter and sometimes they may form uh, in the bladder also. So basically, we will be talking about urinary stone rather than kidney stones because kidney stone is a relatively uh, limited topic, but broadly it is stones in the urinary system. So they can form in the kidneys, they can migrate to the ureter, and some stones can form in the urinary bladder also. So kidney stones are very common in India because we have a tropical climate, and because of the hot climate, uh, 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 the incidence of kidney stones in our country is very high.
Right. Doctor, uh, now that we know about what are kidney stones or urinary stones, as you mentioned, what can be the earliest symptom of the disease? जैसे कि हमें पता है कि कोई भी बीमारी हो, कोई भी कंडीशन हो, शुरुआती तौर में उसे ट्रीट करना, उसे जांच करना काफी इजी होता है हमारे लिए. सो अर्ली सिम्टम्स क्या होते हैं इसके?
Right. So kidney stones basically, this I will just show you a picture. Or can you see this?
Yes.
Yeah.
Can we can
So basically, this
Yes,
is
we can.
a picture of your kidney. So there are multiple calluses in the kidney. That is where the urine gets filtered and it comes down into the renal pelvis. That is where all the calluses meet. And then there is a tube which is called the ureter. And the stones and the urine they will sometimes pass down through this ureter down into the bladder. So basically, kidney stones they generally form in the calluses, and they if they come and obstruct the passage of the urine, they can lead to pain in the flanks, that is uh, in the upper abdomen on the lateral side. Sometimes they may also lead to hematuria, that is the patient may pass blood in the urine. Patients sometimes also have complications because of the stone, which may lead to fever. Sometimes the kidneys may stop functioning properly, and that may lead to signs of renal failure. Some patients may land up with urinary tract infections and sepsis. On some occasions, patients may detect a kidney stones for some other reason, uh, for which an ultrasound or some other imaging uh, modality has been used. So they may be diagnosed incidentally, that is, the patient may not have any symptoms, and they may uh, find having a kidney stone in some other imaging for done some for other disease.
Right. Doctor, what can be the cause behind it? We know that there are a lot of things happening in our body, and if we talk about pain specifically, if we can identify a disease with pain, we know that गैस का भी पेन होता है कभी कभी लोगों को. तो कैसे लोग कंफ्यूज ना करें दूसरे पेन के साथ? Which areas normally do kidney stone patients, like the area where the pain has been targeted, which is the main area where the pain has been targeted to?
Yeah. So if it is the kidney, the location of the kidney is in the flanks, that is the upper
Hmm.
abdomen on the lateral side. So the patient may have a sudden pain on the in the flanks, and uh, you also have a renal angle that is behind in the back region where the costal margin is there and the back, spinal paraspinal muscles meet. There is an angle which is called renal angle. So that is a specific angle where if the patient has pain, the suspicion of the pain being because of the kidney stone is very high. So one is the location of the pain, then other is the characteristics of pain. Many times the pain is colic in nature if the stone is obstructing the passage. Sometimes the patient may also have a dull aching pain. So generally the location of the pain and many times you then will advise imaging, that is ultrasound or a CT scan, which will then confirm or repeat a diagnosis of the kidney stone.
Right. Doctor, again, what can be the causes behind it? लाइफस्टाइल चेंजेस आजकल हम देखते हैं कि बहुत कम उम्र के बच्चों में भी किडनी स्टोन्स पाए जाते हैं, विच अर्लियर नेवर वी सॉ हैपनिंग. सो व्हाट कैन बी द रीजन बिहाइंड इट? व्हाट आर द बेसिक कॉजेज बिहाइंड इट?
Yeah, so main reason of stone formation in the kidney is super saturation of the urine with the stone forming salts. So if the concentration of the stone forming salts it rises above a certain point, then these salts will precipitate and crystallize in the kidney, and they will lead to stone formation. One of the main reasons for this is decrease in the or poor water intake or poor intake of fluids. So if the patient is not drinking enough fluids or if he is dehydrated on a consistent basis, so that leads to supersaturation of the urine, and uh, this can lead to stone formation. This is one
Right.
of the main reasons. Then you may also have dietary reasons. That is some people may have uh, high salt intake, high protein diet. So there can be some subset of patients who have stones because of that, and some of them may also have some metabolic issues like hyperuricemia, hypercalciuria, or
Hmm.
hyperuricosuriya. So these can also the metabolic issues can also lead to stone formation. By and large, kidney stones are not very common in children, but if they
Hmm.
are found in children, then in majority of the cases they have some metabolic issue which is leading
Hmm.
to stone formation. In adults, it is majorly because of poor fluid intake.
Right, right. Fluid intake, we are particularly focusing on पानी का मात्रा कितना होना चाहिए. If we particularly say about drinking water, so how much water to drink, how to drink. We know a lot of people ki doctor has asked them to drink water and they'll drink 1 liter water at once. So what is the right way of drinking water, and how much water should a average person intake in a day?
Right. So this is a very important question, and many people have a lot of doubts about this important aspect. So basically, you should rather than how much water you should consume, more than that, what is important is how much urine you should be producing in a day. So you should be producing about 2 liters of urine in a day. For that, you may require to consume different quantities of water. Some people who are working outdoors, uh, if they're perspiring more, they will need more water. Some patients or some people who are working in a closed environment, in an air-conditioned
Hmm.
environment, they may require lesser water intake. But the primary intention is to have a good urine output of more than 2 liters per day. If we assume about 250 to 300 uh, ml is the quantity of void uh, per micturation, then we should be passing urine about at least 7 to 8 times in a day. You can also monitor the color of your urine. If the color is on the dark or yellow side, then it means whatever amount you are consuming is less, then you should increase your fluid intake. The color should be light yellow, or sometimes even white is okay. Too much of fluid intake is not going to uh,
Hmm.
be of much of a benefit. So if
Hmm.
you have a pale yellow or white color, that uh, will also give you an indication that your fluid intake is good enough. You should be passing urine at least once in 3 to 4 hours, at least once in 4 hours. That is a minimum fluid that you should be consuming. And when we say water, it is not water; it can be any fluid. Intention is to have high water containing liquids, fruits, uh, anything that will increase your fluid intake.
Right. Doctor, well, we are talking about how much water to drink and how important is drinking water. But as doctor has already mentioned that the amount of water should not be more, it should not be less. There should be a balance in drinking water. तो ये पानी के मात्रा में बैलेंस बनाना बहुत जरूरी है. And as mentioned already that the color of the urine can tell you is if it's the right time to have water, or if you're having too much water, or if you're having less water, we can judge it for ourselves. डॉक्टर क्या सब तरीके के किडनी स्टोन में सर्जरी की जरूरत पड़ती है? We normally see a lot of patients who are worried, who are scared of surgery. They normally avoid doctors just because इतने सारे मेडिसिन आ जाएंगे अभी, रेगुलर रूटीन में इंक्लूड हो जाएंगे, एंड देन ऑफ कोर्स सर्जरी is one thing to be scared of. So does all kind of kidney stones require surgery? If not, what are the cases when surgeries are normally opted?
So basically, we will divide the kidney stones into two categories. One are obstructing kidney stones and one are non-obstructing kidney stones. So obstructing kidney stones are the stones, like I've said, this is your pelvis and this is the ureter. So if any stone is coming in the pelvis, this will obstruct the only passage of the urine from the kidney. So these will definitely require surgery. If you don't get operated, your kidneys will eventually start having renal dysfunction, and you will lose renal function over a period of time. There are non-obstructing stones which are in the calyces. So if they are in the calyces and if they are of smaller size, then sometimes you may keep a watch on them. You may do an ultrasound on an annual basis. So I will not say that all kidney stones require surgery. Some stones you may monitor them. uh, Basically, kidney stones, there is a general rule that people should know that medicines are not going to dissolve the stones. This is a common misconception.
Hmm.
Many patients uh, they will try out herbal remedies and other
Hmm. Hmm.
medicines in the hope that they will avoid a surgery. This is generally because of a fear that surgery is going to be risky. But patients should understand that if they have been advised surgery for a renal stone by a urologist, then it itself means that there are no other options. And by seeking these kind of options, the patients will lose out on renal function, and eventually the kidney may stop functioning on a permanent basis also, and that may then require a removal of the kidney also. So I'm not trying to scare away the people having kidney stones, but if you have a kidney stone, if it is an obstructing stone, definitely you have to undergo surgery. There is no other option. If you have a non-obstructing stone, then you may keep them under observation. And if the stone is increasing in size, the urologist may advise your surgery eventually.
Right. Right. Doctor, let's know about the treatment which are available and the diagnosis. So how do we diagnose the patients initially?
Right. So whenever we have a suspicion of any kidney stone based on the symptoms, then we will generally do an ultrasound. In the India setting, we'll generally do an ultrasound first. Once the ultrasound shows us a stone, then we'll also see the size of the stone, the location of the stone. Generally speaking, the accuracy of an ultrasound for detection of a stone and the other parameters of the stone is around 70%. It is not very accurate. So we will always try to corroborate the findings with some other investigations, like a plain X-ray followed by sometimes and CT urography, or even in some occasions when CT is not available, we may do an intravenous urography in which we inject the dye in the vein, and then the dye is excreted by the kidney, and we'll do an X-ray every 15 minutes. So your kidneys, once where you can see it on this photo, so you'll be able to see the patient's kidney and its anatomy and the parameters of the stone on the X-ray, on the basis of which you can plan your surgical intervention. So you may also, once the patient has been planned for a surgery, you will also require to check his blood parameters like CBC, creatinine, electrolyte, etc.
Right. What about the treatments which are available currently, doctor?
Yeah, again, very important question. The people and the patients, they must understand that treatments available today are almost all of the patients are offered minimally invasive treatment options. Uh, Majority of them are sometimes scarless also. So we have majorly three categories of treatment. One is if the stone is very large, then the patient will require to undergo a PCNL. PCNL is basically where you create a new track into the kidney from the back, and then once you locate the stone, then the stone is removed through a nephroscope, that is a scope which is passed into the kidney. You also have another option for medium size stone, which is RIRS. So basically, RIRS, you have a flexible scope which is passed into the urethra and then into the ureter, and it can enter into the calyces because the flexible scope has a flexible tip. So this is RIRS, and the third option is ESWL, that is extracorporeal shockwave lithography, which has gone out of favor because you have excellent endoscopic treatment options available. But yes, ESWL is also an option which can be done for soft renal stones.
Right. Doctor, how long does it take for a person after surgery to come back to his normal life?
If we have done RRS, the patient can be discharged next day also. That is, in 24 hours, he may be discharged and he can resume his daily activities. If we have done a PCNL, then PCNL, there are multiple options starting from ultra mini PCNL, mini PCNL, PCNL. So basically, this is the size of the scope that we are using. If in ultra mini PCNL, mini PCNL, the size will be as small as the ripple in this pen. If you have a very large stone, then you will have to put in a bigger scope of almost the size of this pen. And the hospital stay for PCNL is generally about 2 to 3 days, depending on which kind of PCNL you have done. Mini PCNL, you may discharge him after 48 hours. Traditional PCNL, that is standard PCNL, where you have a bigger scope, for a larger stone. The patient may require to stay in the hospital for about 3.5 days. If you have done a ESWL, that is extracorporeal shock wave lithotripsy, that is an OPD-based treatment. Patients can be discharged uh, immediately after the session is over.
Right. Um, Also, another problem with kidney stones are the recurrence of kidney stones. We hear a lot of patients saying कि treatment हो गया, surgery हो गया, but again after a couple of months they are facing the same issue. So, what can be the reason behind it? Negligence of the patients or the doctor, or lack of improper diet? What can be the reason behind it?
See, this term negligence has to be used very cautiously because when it comes to a doctor performing a surgery, uh, I will assume that he is not going to be negligent. So I
Hmm.
will advise people and everybody to use that term very cautiously because you are actually uh, trying to imply that the doctor has intentionally or he hasn't lived up to the professional standards.
Hmm.
So any
Hmm.
doctor who's a trained urologist will generally try to remove as much stone as possible. But we must
Hmm.
understand that when we are passing a smaller scope, and we are doing an endoscopic surgery, there are many limitations that are there. For example,
Mm.
if you have a very large stone and you are doing an endoscopic surgery, all these surgery have to be finished in 2 hours. So if the stone
Mm.
burden is very large, the patient may require to undergo a second stage surgery after say 48 hours. Generally speaking, we will always try to remove the stone in one sitting, but in
Mm.
exceptional cases where you have a very high or very large stone burden, or sometimes the patient may require in a PCNL, they may require multiple tract creation or multiple entries into the kidney, and sometimes this may not be possible in the available time or stipulated time of 2 hours. There are various reasons why this 2 hour parameter is there. Again, you must understand that when we are passing a scope into the kidney, then we will access the kidney generally from one calyx, that is, you will say one of the rooms in the kidney. And sometimes the stone, while fragmenting or otherwise, they may be located in the other calyces, and it may not be possible for the surgeon to enter the other calyces because the scopes are rigid in a PCNL.
Mm.
So, generally speaking, we'll use a rigid scope because the flexible scope may not be available in all centers, and they're very costly and they have other technical issues. So, generally speaking, we'll be using the rigid scopes commonly, and it may not be possible for the surgeon to enter every calyx during the surgery. So, whenever we plan our entry into the kidney, we will do our first entry, or we'll plan our entry in such a way that majority of the stone burden will be removed to that single puncture. But as I said, in the rare scenarios, and I'm saying in
Mm.
rare scenarios, sometimes the patient may require a separate puncture. Sometimes the patient may require second stage ancillary treatment. That is, after 48 hours, patient may require RRS for complete stone removal. This is
Mm.
not very common, and I will generally say that if you talk about the statistics, then all these surgeries, if you go by the books, they will say that the stone-free rate is 86%. That doesn't mean that 14% patients will always have, I mean, they will have residual stones in the kidney. But if you take the overall, then
Mm.
the statistics will say that the stone-free rate is 86%. That is, out of 100, 14 patients may have residual stones in the kidney. Then again, it is important to note that if the stone size is less than 4 mm, then this is a
Mm.
passable size that the stone can pass through the ureter. And generally speaking, that is considered as an insignificant size of the stone. And the patients, when they undergo this surgery, many times they may have multiple small fragments in the kidney which are residual, and the patient, that is why is advised to drink a lot of fluids after the surgery so that he will pass this stone dust or small residual calculi through the kidney. If the calculi are more than 4 mm, then generally speaking, we will say that the stone-free rate is, or the patient is not stone-free, and he may either be kept on watchful waiting, he may require annual checkups, so to check whether the stone has moved down into the ureter or not, and sometimes he may be offered ancillary treatments, which is sometimes RRS, ESWL, or a second stage PCNL, depending on the size of the stone. Uh, what I think your question implies is not this particular issue. What I think your question implies is patient is stone free, and then later on in his
Right.
later life he has again got a recurrence.
Right.
Okay,
Right.
so that is a separate issue. For that, the patient is advised to drink a lot of fluids. If he's stone free, he may be advised metabolic checkup. uh, he also needs to consume diet in a proper way so that his diet is not such that he's uh, high, or he's in a high risk category for a recurrent stone formation. So all this is important, and he again has to come for regular checkup at least once in a year. So that is for lifetime. So once he has formed the stone, it means that he is in a high risk category, and he should check every year with ultrasound whether he is having the recurrence or not.
Right. Doctor, you spoke about diet. So, what kind of diet do we normally ask the patients to take?
Right. So diet, many times, this is again a very confusing topic for patients, because the patients will generally have a lot of relatives and uh, people who are basically uh, not expert in this subject. They will give him various type of advice. Don't eat palak, tomato, and there is a huge list what the patients will generally tell you. So this is basically an outdated concept that the patients require a very uh, high dietary restrictions of various kinds. Today, the research will tell you that uh, in diet, the most important thing is water intake. Second important thing is that the high salt intake, high protein intake should be avoided. Now, again, high protein intake is a very confusing topic. People think that whatever protein, they'll stop all the protein. They must understand that if whatever their weight uh, there, they should have protein intake which is uh, corresponding to that weight. So, say if I am say 70 kg, so I should consume at least 70 gram of protein in a day. In an Indian setup,
Mm,
we don't even consume 10, 15, or 20 grams at the most. So
right.
patients will stop whatever one vati dal they are using eating, that will also they will stop. So high protein diet is when you are exceeding the dietary advice for your weight. Okay, so you must not exceed, but whatever your body needs, even calcium. If your body needs calcium and you're deficient in calcium, even if you have a stone, the doctor may advise you to take calcium supplements also. So that
Mm,
doesn't mean that if you have a stone, you should not take calcium. Whatever your body need is there, or body requirement is there, depending on your weight and other parameters. You can meet a dietitian, find out what all dietary requirement you are having based on your body composition, weight, and other parameters, and you should take the diet as per the advice of a dietitian. If you are very or you want to be absolutely sure that you are taking the proper diet. But following a random advice like not eating all these kinds of vegetables and spinach, green, they are actually needed by the body, and it has been found that if people start following this kind of random advice, the stone forming risk is actually increased rather than it decreases. So that is a very there are very many myths regarding the diet, and people should follow scientific advice from qualified people. It is very simple. You can just go and buy a book on diet and read for yourself what is advised and what is or what you should be consuming on a daily basis.
right. Uh, because we are talking about myths here. We know a
Right,
lot of myths related to kidney stones, starting with
right,
home remedies. I belong from a city where people hardly take medications. They normally depend on nature. तो अगर किडनी
right.
स्टोन भी हुआ, बहुत सारे पत्ते हैं, उनका रस पी पी लेने से किडनी स्टोन निकल जाता है. पीपल स्टिल बिलीव सच थिंग्स. So, can these home remedies be harmful for the patients, or does it even work?
No, they are not going to work. The
Hmm.
people should first decide why are they having this belief. Is
Hmm.
there any proof that this will work? Who has advised? Whoever has advised, does he have any qualification in that subject, or does he even have some knowledge on that subject? Why am I listening to
Hmm.
this person?
Hmm.
You can go and search on the internet whether this works also. Again, when you are searching, you have to look from the source of,
Right.
from where you are searching or to whom you are listening. So he has to be
Hmm.
a qualified person, or you have to read from people who are qualified in that subject. So all these herbal remedies, I mean, I don't think they are going to be of much of a benefit. Only it will help for the patient's mental satisfaction. Say, I'm doing something.
Hmm.
So other than that, it is not going to help. And if they have an obstructing stone, they are losing precious time, because each day they are losing precious renal function. And eventually, I will say almost 60 to 70% of the patients fall for this kind of blind beliefs, and major
Right.
almost two-thirds of my patients who come, they will have tried all this kind of treatment, and ultimately when the pain has increased to such
Hmm.
a severity that they cannot bear it, or they land up
Hmm.
with some complications. There is infection, then they have started having fever. So then instead of having one surgery, they'll require two, three surgeries, one for removing the infection, sometimes then one for removing the stone. The stone will be large, they may require other ancillary procedures. So timely intervention is very, very, very important. If you don't want to
Right.
lose renal function, I will try to tell one very important point here. The aim is not to remove the stone. In
Hmm.
stone treatment, the aim is never to remove the stone. But the patient will say, "What am I saying?" So this is very, very important. The aim is to preserve kidney function. You must not lose kidney function because of these kind of blind beliefs or treatments which are not scientific. The aim is not to avoid a surgery. If the surgeon has avoided surgery, it is for a reason, and that is the main reason is to preserve your kidney function. That the kidney must not lose, or you must not lose uh, your kidney function on a permanent basis. Now, when I say losing the kidney function, it may be partial or it may be complete. पेशेंट समटाइम्स उनको किडनी फंक्शन यूज मतलब पूरा ही खत्म हो गया ऐसा नहीं है यू विल lose 50% of your function also, but then why should you take that risk? Okay,
Hmm.
so if the stone is obstructing, it is, and if it is of a larger size, then it is always advisable that you get it removed as soon as possible rather than lose your kidney function.
Right. Another myth, doctor, which is related to kidney stone is drinking a lot of beer can wash away the stone. So is it true? I personally have met a lot of people who says कि खूब सारा beer पियो तो stones निकल जाएगा. Is it true? Can alcohol be harmful in case if it's not true?
Yeah, I will rather give a sarcastic answer to this, that your beer will, I think, will surely help, but it will also surely damage your liver.
Huh?
So, do you want to damage one organ just to save one organ? No, that will not be a very wise thing to do. Basically,
Hmm.
drinking beer, the concept is basically you will be passing more urine because it is another liquid or fluid. So you have many other options. You may drink water instead, or you may drink other some detox drink or something, which is again going to produce more urine. Beer is,
Hmm.
I think this myth is because of the people who want to find an excuse why they should consume beer or alcohol. There is
Right.
no other reason.
Right. Right. Um, uh, Right. Well, we now know about the kind of diet we should follow. We have also spoken about how much fluid to intake, how to intake. Um, uh, Moving ahead, I can see a few questions coming up from the viewers. Doctor, the first question comes from Sona Sharma, who asks, "Can blood test detect kidney stones?"
No, no, they can't. See, kidney stone is inside the kidney. So you require
Hmm.
some kind of imaging, either an ultrasound or an X-ray or an intravenous urography or a CT scan. So the best will be a CT scan. Second can be a combination of an ultrasound or plain X-ray or IVP. So you require some kind of imaging where you are imaging the kidney or the urinary system
Hmm.
uh, to find out the stone, its location. It is not just the stone. You also need to see the size of the stone, the location, what effect it is having on the kidney. There are a lot of other things that you need to see also. It is not just you detect the stone and then you uh, start having, start the
Right.
treatment.
Right. Doctor, what about diabetic patients? We know that it normally takes a lot of time for the diabetic patients to get cured in no matter whatever the kind of disease, whatever the kind of condition it is. So, what in case of kidney stones? Does it look a little different for the diabetic patients?
Yeah, so basically diabetes is very common in India. India is the diabetic capital of the world. So almost 60% of our patients will have some other medical issues like diabetes, hypertension. something like that,
Hmm.
ischemic heart disease or something like that. So these are basically patients who have a medical comorbidity, and then uh, uh, compared to a normal patient, we'll have to be more careful because we need to confirm that their sugar is under control. Because if it is not, then they have a high risk of complications like infection, etc. Then required to involve the physician into the team so that we ensure that his blood sugars are under control during the uh, perioperative period, or even if he is under some actual waiting, we want his sugar to be under control. That is recommended even otherwise because he may have some other problems because of the raised blood sugar. So sugar patients must get their sugar under control, and uh, generally speaking, there is a slightly higher risk of complication, but it is not something which is something to be scared of. Once you have a stone,
Hmm.
doctor has advised a surgery. You will require to involve the surgeon into the team so that he is taking care of the treatment of the diabetes during your surgical treatment is ongoing.
Right. Doctor,
Some extra care
you
is
said
required.
that.
That is all.
Right, right. You mentioned, doctor, that normally patients come with a lot more diseases whenever they come. Normally, 60% of the patients they do. So, what if somebody is having a kidney stone since a long time? He or she is prolonging it. So, can it trigger any other organs in our body?
Uh, So basically, if the stone is, I mean, it is damaging the kidney, then eventually
Hmm.
if the kidney will start failing, and then patients will, if you do a blood test, then you will see a raised creatinine, then that can lead to other problems like the hemoglobin will then start decreasing. It is a chronic kidney disease. So hemoglobin will start decreasing, they will have electrolyte imbalance. The sodium will start decreasing, the potassium will start increasing. That will then have effects on the heart, and other metabolic issues will crop up. So that is, I think, a neglected case where the patient is neglecting the treatment for a long, long, long time. Some
Hmm.
patients may not realize this, and will realize only in the later stage because many patients will have large stones in the kidney which are asymptomatic. That is, the patients have no symptoms at all, and they
Hmm.
will
Hmm.
directly present with signs and symptoms of kidney failure. Yesterday only I saw a patient who has a creatinine of 15. Normal creatinine is 1.5. He had a creatinine of 15. He has both kidneys are blocked because of the stones, and he didn't have any uh, symptoms till few days back, and it was diagnosed just because of the signs of renal failure. So this can happen.
Hmm.
So any patient who is above 40, they should generally have a routine health checkup, like basic blood test. They should do. You should do a basic
Hmm.
ultrasound, not if not in a year, maybe in once in 3 years or so, just to be sure that everything is
Right.
fine.
Hmm.
These
Right.
are
This
very
is
basic
this
and very cheap
exactly.
investigations, and ultrasound will hardly cost about 1,000 or so. If you go to a charitable institute, you'll get an ultrasound in 300, 400. So this
Hmm.
basic health
Hmm.
checkup, people should get it done.
Absolutely. Right. Well, we always suggest our patients that एक रेगुलर रूटीन चेकअप बहुत जरूरी है आपके लिए जस्ट टू नो कि आपके बॉडी के अंदर क्या चल रहा है देर आर लॉट ऑफ
Right.
थिंग्स हैपनिंग इनसाइड आवर बॉडी एंड वी नीड टू नो आवर बॉडी स्पेशली द काइंड ऑफ चेंजेस विच आर हैपनिंग बहुत लोग रियलाइज ही नहीं करते अपने बॉडी के साथ क्या हो रहा है कोई भी बदलाव कोई भी छोटा सा भी बदलाव अगर आप नोटिस करें अपने बॉडी में मेक श्योर आप जा रहे हैं अपने नियरेस्ट एक्सपर्ट के पास या गेट योर सेल्फ चेक और डायग्नोस्ड द नेक्स्ट क्वेश्चन डॉक्टर comes from Pooja Sharma पूछती है is drinking more water effective for prevention?
Yeah, as I said, if you're drinking 2 liters or you're producing 2 liters of urine in a day, that is good enough. Anything
Hmm.
excess is not going to be of much of a benefit, and you will have to pass urine more often, so you'll have a frequency of urination, which is not of any significant benefit. So if you are passing urine 2 liters a day, that is, you are passing a urine once in say 3 hours, 4 hours. That is good enough. Anything excess is not going to be of much of a benefit.
Right. The last question, doctor, comes from Pooja, who asks, can kidney stones lead to kidney damage?
Yeah, that is what I'm talking about since last 30 minutes. So if you have an obstructing stone, obstructing is again it is blocking the passage of the kidney. See, I will just give you an example of. I am sitting in a room. I have this chair, this table, and I have an entrance to this cabin. So this furniture is not causing any problem right now. But if I keep the chair in the path of the doorway, then it is going to obstruct the passage. So it is similar in the kidney. If you have a stone which is obstructing the outflow, then this is going to cause obstruction to the urinary passage downwards, and this is going to cause increase in the size of the kidney. It will cause a ballooning of the kidney because the urine will be produced by the kidney, and there is no way to go down. So the urine will get stagnated in the kidney, and the kidney will increase in size, which is technically called hydronephrosis. And once this happens, the kidney will get stretched, and all the cells where the filtration is happening, that is, the blood is getting filtered. So these cells will start getting damaged eventually. So when you do an ultrasound imaging like CT or IV urography, if you find that there is a hydronephrosis, it means that the kidney is obstructed, and that will, because of the stretching of the kidney, the stretching of the cells, this is going to cause damage to the kidney function. Eventually, uh, slowly you will start losing kidney function. And many times this may not correlate with the symptoms. This may not correlate with the pain. This can be a painless process. Sometimes the patient may have pain and the kidney may go into shutdown, and the patient may feel that pain to khatam ho gaya. तो अभी तो ट्रीटमेंट ही नहीं करना है, डॉक्टर ने तो बहुत अच्छी ट्रीटमेंट. नो, it can mean that the kidney has gone into shutdown and you require immediate surgical intervention. So pain has no correlation, direct correlation with the severity of the obstruction. You may have a severely obstructed kidney which has gone into shutdown, and you may not have any symptoms, or sometimes your pain may also suddenly disappear because this kidney, sometimes, if it has gone into shutdown, the blood has started back filtering the urine and it is getting diverted to the other kidney. So the other kidney has taken over the function, and this kidney has now gone into shutdown. So all these things are very important, and only a trained urologist will be able to assess all these parameters and advise you properly what treatment should be done. Again, there is a very common problem which I think must be addressed, that patients don't know who is exactly the doctor for this. So if you have a stone, the patients must know that they will have to go to a urologist. Sometimes the patients feel that a nephrologist is also a kidney doctor and he will also treat the stone. No, nephrology is a medical field, and they are not basically surgeons, and they are not uh, basically expert in stone management. And uh, as I've already said, there are many other people who claim
Hmm.
to be experts in kidney stone management, but if they are not urologists, then I don't think we'll be getting the best advice on treatment.
Right. Well, that was the last question for today, Doctor. We had a wonderful discussion. It was very informative. Before we take a leave, any take home message for our viewers who has watched us so far?
Yeah, so I would advise all my viewers to be very careful, and they should do annual health checkups as far as kidney health is concerned. If not annually, at least once in 3 years, they should check their basic parameters. You get ultrasound. You should understand that we live in a hot climate, we live in a tropical climate, so adequate fluid intake is absolutely essential. I would also advise people not to follow the you know random dietary advices from people. They should read for themselves. Sometimes, if they have any doubts, they can consult a dietitian regarding this. And dietitian again has to be a qualified dietitian. People again confuse dietitian with a nutritionist. So dietitian is a qualified person, a degree holder in that field. So you talk to your dietitian if you have some dietary doubts about your dietary habits. And if you have a kidney stone, then go to urologist. If you have an obstructing stone and if they have advised a surgery, don't be fearful. Get your doubts cleared. You should also fear that you may lose your kidney function. So if you have a fear of surgery, get your doubts cleared. What surgery? Talk about the various options. Choose the best option that suits you. Some options may be costly, some options may not be costly. If you have issues, you can also, regarding the budget, we have a huge population in the rural areas who sometimes may not uh, afford very, you know, technologically advanced treatments. So you can talk to your doctor whether these treatments are available in government setups. The government is doing excellent work as far as making these treatments available in government hospitals. So you can go to a
Hmm.
government hospital. There are multiple health schemes that the government is running. All these uh, stone treatments are available in the health schemes. You can go to a medical college. You can go to a government hospital and get this surgery done in case you can't afford it into a private hospital. Be sure that the treatments are available, excellent treatments, minimally invasive treatments, which do not damage your kidney. Uh, Many treatment options are scarless. So don't postpone the treatment unnecessarily because you may lose your precious renal function and uh, you may have to pay a price in a later life for that. So be healthy and save your kidney. That is all I want to say.
Well, all right. That was the expert advice for today, and that was Dr. Vikram Deshmukh for us. Thank you so much, Doctor, for your valuable time. It has been quite an informative session for our viewers today, and we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information and updates, stay connected on our Facebook page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Yeah, thank you.